Hi, my name is Abby Sine, and I'm going to be doing my newborn assessment on this stuffed animal. So here I go. I would knock. I would do hand hygiene. I would put on gloves, and then I would begin. I would want to begin by palpating the head, palpating the anterior fontanelle. And then I would move to the sutures, and I would want to make sure that the sutures were lined up. They could be overlapping or they could be separated, but I would just want to be sure that they're majority lined up. And then I would check the posterior fontanelle, and I would just feel, and I would look for any abrasions that could have happened during birth, any signs of hematoma. And then I would move to the ears. I would want to check each ear and make sure that there is a pinna, there's no drainage. Then I would move to the eyes, and in the eyes, I would want to make sure that the sclera was white, and I would pull down on the eyes to check the conjunctiva and make sure that it's pink and there's no signs of swelling on the eyes or drainage. I would want to look at the nose, and then I would actually put my finger in the baby's mouth, on the roof of the mouth, and I would feel for the palate, make sure it was soft. In this way I could also check their sucking reflex as well. So next I'm going to move down to the neck and the clavicle. I just want to be sure that there's no signs of fracture from birth, so I'll gently palpate those. The baby might have some acne on their face, some red acne, and this is actually normal, and I wouldn't want to be alarmed of that. And then next I would auscultate the baby's breath sounds and their lung sounds and their bowel sounds before I start palpating their abdomen. So I'll listen to the aortic, the mitral, the tricuspid, and then I would be sure to listen to the breath sounds. And it would be really important for me to cover all of the area as I don't want to miss that. And then of course their 4-quadrant bowel sounds as well before I start palpating. And then I would want to palpate the abdomen, be sure that I don't feel any distension, and the baby's belly could be protruding, but this actually could be a normal finding because babies don't have very strong abdominal muscles quite yet. I would want to check all of their pulses, both radial, both carotid, both femoral, both post-tib, and both dorsalis pedis pulses to make sure they're all present. I would take note of the skin, make sure the skin was even and distributed appropriately based on their race and their skin color. And then I would want to check their stautal reflex. So I would actually let them grab my fingers and I would pick them up. And this can also check like their neck strength and their grasping reflex and strength. And then to check the Babinski reflex, I would just stroke the feet and the toes would fan open. So I would just want to check those. I would want to check on a male, I would check if they were circumcised. I would see how that's healing. I would make note. I would want to palpate and make sure that there's 2 testes present. And then I would actually want to lift up the legs to look at the bottom, make sure there is an anus present, both in male and female. If it was a female and I was checking this area, the genitalia area, I would make sure that there's 2 labia, and there's a separation in the labia. Make sure it's not together as one, and I would also want to check to make sure an anus was present as well. Important. I would want to check their umbilical cord. I would want to make sure that there's no abnormal drainage color. A dark color is normal, but for a newborn, but I would just want to make sure there's no drainage. And then I would want to check the back of the baby, make sure the skin is also well distributed. And this will complete my newborn assessment. Thank you for watching.